visit. The nurse will do a full body, we call mole mapping. They will take a full body photograph. So first facing me with your hand a little bit apart. Good, ready to capture. The camera is automated, so it goes from top of your head all the way to your toes and take automated pictures. Then we ask you to move facing the wall, and we do the same for your back. And then we ask you to take 2 sideways position, and we take the side. Good, and if you could put your arms slightly separate from each other, that's great. If the dermatologist or the patient request close-up because they're worried about some specific moles, then we take further picture with another handheld camera, which take 20 magnification picture, which are essential for diagnosis as well. However, the beauty of the full body mapping is that if you blow up the picture of the back or the tummy, you can see these moles in very high resolution as well. Your mole is completely benign. It has a lovely edge. You can see shade of brown. Totally benign, can be left alone. I think the reason we were very keen to have the latest PhotoFinder full body mole mapping machine was because first you can have a whole body photograph with a very high resolution, so you can increase the images, blow them up and look at individual mole, which you were not able to do before because the resolution was too poor to be able to magnify the mole one by one. We're very fortunate in this clinic to have people who have long-term experience in dermatology, happy to assess images, especially images with this 20 magnification that I mentioned. And yes, the level of expertise is high, but with this extra tool now we are much better. We see changes earlier, we can reassure patient the other way around because we have such amazing tool to photograph a mole. We can say we photographed it 3 months ago, it's absolutely static, it's not doing anything, don't do the surgery. So we're actually decreasing the number of people who end up having unnecessary surgery. So it's also very useful for that. So for us, it's especially if your area of expertise is melanoma, they are essential piece of kit. When we didn't have this equipment, you might say, okay, I take a photograph of your leg and then I take a close-up of one mole, and then you may come back in the future. And the patient come back and say, well, now I'm worried about one on my arm. And I said, well, last time I didn't take your arm. You know, so now we just know we have a fantastic baseline. So it really is helpful to know what did the patient look like a year, 2 years ago. And this is extremely valuable. All my colleagues working in this field always say it's a very instinctive diagnosis. You know, your gut feeling saying, I do not like this mole and I like this mole. It's a very instinctive thing. However, if you have an added AI, where you can click on a little AI button when you look at the mole close up, and the AI tells you, looking at all the different algorithms for deciding whether a mole is malignant or benign, I have classified its color shade from yellow all the way to red with a score attached to it. And if the machine tells you, I'm not really happy with this mole, and usually, let's be fair, usually your gut instinct was already, not happy with this one, and then it's an added tool and the machine say, I've been trained on thousands of pictures and I classify your mole as, towards the worrying side. PhotoFinder mole mapping is essential for 2 scenarios. So the first scenario, you would be identified as a patient who has a large number of moles, especially large moles. You may have a family history of melanoma, you may have had a previous melanoma, so it's very likely your dermatologist would have identified you as a high-risk patient already. So this again would be a very good example of a patient at high risk, a large number of atypical nevi, which are a bit bigger than average, around 4, 5, 6 millimeter in diameter, And one of them was picked out here saying, from far away it's looking a little bit asymmetrical, and then when you look at it closely it's probably a very borderline lesion, but there are already some suspicious changes in the middle where the mole has a bit of pink. It has lost some of the features on the side because you can see here inflammation in the middle of the mole, so that will be regarded as suspicious. Then we do mole mapping for sure on a yearly basis, and that's essential to have fantastic picture sequentially, because not only the clinician will look for change, but the machine has an AI assisted software which will say that mole wasn't there a year ago, or will say that mole has changed since last year. So that's for the really high risk people, and this kind of equipment is really ideal for this. The second scenario is you are worried, you are home, you want a quick advice on the mole, cannot get a hold of a dermatologist for a face-to-face, are worried about waiting weeks, and can come directly to the clinic, get an appointment with a nurse and have full body mapping. Same position but the other side, plus close-up of the mole they are worried about, and then an advice given back within 48 hours. You may not necessarily have 100 moles, you may have only 5, but one of them is worrying you. They sometimes say, Dr. but I haven't slept for 3 days because I'm convinced I've got a skin cancer, and we are there quickly to reassure them. And actually the good news is most patients will reassure them. Say, you might have been worried because it was a bit pink or it was a bit inflamed, but now it's all right, and we reassure them. So, you know, melanoma is important to diagnose, but it's not that common. So many patients will come, big smile on their face when they leave the clinic because we told them there's nothing to worry about. A lovely mole with lovely shape. We haven't lost any of the network we're always looking for with a little circle, benign.